Critical care nurses face ethical issues on a daily basis, whether involving professional ethics or helping a patient or family sort out their own ethical issues. This lesson touches on a few of the most common ethical issues in critical care nursing: palliative care, withdrawal of care, advanced directives, and medical power of attorney. Let's say patient J has suffered damage to his lungs and can no longer breathe on his own. He'll be attached to a ventilator for the rest of his life, and he needs to be revived several times a month. However, patient J is awake and oriented the majority of the time. During one oriented period, he asks to be made a DNR, or do not resuscitate patient, meaning that if his heart stops again, he doesn't want to be brought back. Patient J's sister doesn't agree with this and tells the hospital her brother isn't competent. She threatens to sue if the hospital allows her brother to become a DNR patient. She wants everything done to keep him alive. The cycle of patient J's heart stopping and being revived continues for several months. Finally, the hospital is able to assemble an ethics committee to determine that patient J is competent and able to make his own decisions. He chooses to become a DNR patient and dies peacefully within a few days. In patient J's situation, once he became a DNR, he didn't remove his ventilator, he chose palliative care. Palliative care is caring for a patient to relieve pain and make the dying process as peaceful as possible. Depending on patients' wishes, they're given food and hydration, but nothing considered a life-saving measure, such as CPR, dialysis, or surgery, unless the surgery is to relieve pain and not aimed at curing the patient. Had patient J decided that he wanted to remove the ventilator that was keeping him alive, he would have been withdrawing care. This is seen a lot with patients who are brain dead, but their heart is still beating. In this case, all life-saving components, such as the ventilator and any medications, would be stopped and the patient would be allowed to pass away. Patient J's scenario is all too common in the intensive care unit. When a patient is dying, one family member might want everything done to keep the patient alive, while other family members, or the patient him or herself, might want a peaceful death. This is when an advanced directive or medical power of attorney is very useful. If the patient has neither, the hospital ethics committee must determine what the appropriate action is. An advanced directive is a statement that's written by a patient and signed by two witnesses, not family members, that details how the patient would like to be cared for should he or she become terminally ill or unable to make decisions, in which case, the document appoints someone to make medical decisions for the patient. Doctors and nurses use this statement to determine what the patient's wishes are and make sure they're followed. There are two types of advanced directives: living wills and medical power of attorney. When assisting patients in making advanced directives, there are a few things to consider. First, the patient's personal and cultural values and morals must be taken into account. Additionally, several ethical principles must be considered. The first principle is autonomy. Autonomy is the right patients have to choose what happens to them. Healthcare workers must respect the patient's choice and not let their personal beliefs and morals influence the patient. The next principle is beneficence, which means to do only good and to remove or prevent harm. Included in that principle is the element of non-maleficence, which means to do no harm. A living will explains how a patient wishes to be cared for when the patient reaches the end of his or her life. It can be changed anytime and is only made active once the patient can no longer make decisions. However, in some states, it can be overturned by the family once the patient is not competent or is unresponsive. Therefore, it's important that the patient speaks with the family before the time comes and make sure the family understands and agrees with the patient's wishes. A medical power of attorney is a document that gives one person the right to make all medical decisions for the patient, should the patient not be able to make his or her own decisions. It differs from the living will in that it becomes active anytime the patient can't make decisions, even if the patient is not terminal. It also cannot be overturned by family members. However, the delegated person doesn't have to follow the patient's wishes, so again, it's very important to choose someone who agrees with the patient's wishes. Critical care nurses encounter ethical issues on a daily basis. These dilemmas can be made easier if patients have established advanced directives. When assisting a patient in writing advanced directives, a nurse should ensure that the patient is allowed to make his or her own decisions, and also that the directives are for the good of the patient and will not cause harm. It's also important for the patient to talk about end-of-life wishes with family, as well as the person with power of attorney, to make sure these individuals agree to honor the patient's wishes. Medical disclaimer: the information on the site is for your information only and is not a substitute for professional medical advice.